Hillary Clinton's wobbly incident Sunday is a near textbook case of what can happen with walking pneumonia. Patients don't feel great, but they're not sick enough to stay at home, in bed, or to be hospitalized. Clinton caused day-long speculation when she left a September 11th memorial service in New York and was seen being helped into an SUV, not too steady on her feet. The doctor says it turned out it was pneumonia and dehydration. Dr. Jonathan Cantor joins us to talk about pneumonia. It's an infection that gets into the lungs. Serious? Treatable?
Well, thank you. Great question. Great questions, actually. Pneumonia is a very common condition. It is not usually serious, and it is absolutely treatable. The sounds like what happened here was, we all know about that coughing fit on Monday, made a big deal about her Trump allergy during that coughing fit. And then, the week went on. Friday, of course, there was some speculation about things that were going on, and now it turns out that indeed what happened yesterday was, just related to her pneumonia. Now, the question, of course, is how significant is this? How important is it? I would argue that we don't have enough information to say too much, but certainly I don't think there's any cause for concern. Pneumonia is very common. She is 68 years old, otherwise healthy. Not surprising, given her grueling schedule. Listen, the one candidate we have is 68, the other is 70. They have been working, to the bone, regardless of how you feel about either candidate. They have been working really hard. They have been active on the road
for the
better part of 3 years.
Yeah.
That would be taxing on you or me, and certainly somebody who's a couple decades older. That's going to be really tough.
And her doctor said she was on some antibiotics, and you can have some adverse reactions.
Absolutely. We don't know. We know she started antibiotics on Friday. We don't know what she's taking. Again, we're literally Monday morning quarterbacking now, trying to figure out what happened. But we don't know what happened. And certainly it could be even the medication. Even if she had a very mild case of pneumonia, there's some people where they can be on a little bit of medicine, they can be totally healthy, and depending on how that medicine disagrees with them, they're not going to feel great, they're not going to feel right.
How does it manifest itself?
Well, that's a great question. Typically, the first sign of pneumonia is going to be a cough. So as we've seen with Secretary Clinton, she also has a history of having cough in the past. Back in the spring, there were a couple episodes of this. But we also know she's got a history of allergies. And so having a little postnasal drip, having a bit of a cough with that, not surprising at all. Certainly, though, pneumonia, you think of a cough. Cough doesn't go away, feels really deep-seated, and ultimately becomes what's called a productive cough. We don't need to give too many details on television during the morning while people are drinking their coffee, having their breakfast. But with a productive cough, with a fever, and when it's not going away, particularly in people over age 65, definitely a cause for concern, definitely a time to check in with your doctor and just make sure everything's all right.
You talk about age 65, and that prompts an even bigger discussion. A lot of people are thinking about getting flu shots. People over 65 also should be thinking about getting an inoculation against pneumonia. So that's the broader issue we've got to approach here.
Absolutely, absolutely. And one of the things to think about here is, we can think of this as a little wake-up call at the beginning of flu season for all of us. It is absolutely critical. The flu vaccine is out there. The pneumonia vaccine is out there. Some of them are appropriate for everybody. Some of them are appropriate for only those aged over 65. We've got to think and realize, listen, vaccines are the single greatest advance in healthcare over the past 3,000 years in terms of lives saved. So absolutely, we should avail ourselves of those opportunities, and that can really make a difference and really avert what could ultimately be a tragedy.
Now kids should get flu shots too, but you talked about the 65-year-old threshold for pneumonia shots for seniors. Should somebody maybe in their upper 50s or 60s consider them as well?
Absolutely. It's a great question. The CDC recommends flu vaccine for everybody. So basically, they say anyone over, over age baby level needs to get a flu vaccine. And again, flu vaccines are something you need to get every year. It's not the kind of thing where you can say, oh, I had one 8 years ago, I think I'm fine.
Because the strains keep changing.
Exactly, exactly. The strains keep changing. And in terms of how powerful they are and how long they last, with some of those vaccines, they don't necessarily last that long. So
10 seconds. But the pneumonia vaccine.
Pneumonia vaccine, absolutely something to consider, absolutely something I would definitely encourage. It's standard, we think about it for children, definitely age 65 or older, absolutely something you should be looking at.
Dr. Cantor, always a pleasure. Good to have you here. Well, if you missed any of this interview, watch it on news4jax.com. It'll be posted about 10:30, 11 o'clock this morning, posted on the morning show page. Jen?